After experiencing a harrowing second coronavirus wave in which India witnessed a peak of 4 lakh cases and record-breaking deaths, the country got some respite in mid-August as the number of cases dipped. States began to lift the COVID-19 lockdown restrictions, bringing with it a glimmer of hope for things to return to normalcy. But wait, if you thought the pandemic is over, then think again. New infections have surged once again, with experts now suggesting that India is staring at a likely third wave. The time and the scale remain uncertain. Regardless, we have to be prepared, and one such powerful tool at our disposal to combat the imminent threat is self-test kits. Self-test kits can cut the pressure on diagnostic laboratories, reduce costs, and provide results within 15 minutes, leading to a prompt treatment and isolation. As a result, you and your loved ones remain safe, especially with the third wave of the pandemic looming over us. Asianet spoke to Dr. Satyanarayana Mysore, Head of Department and Consultant, Pulmonology and Lung Transplant Physician at Manipal Hospitals, Bengaluru, to understand the current situation, the threat of the third wave, and how self-test kits can be your go-to tool for precaution and cure.
Since the May-June of 2019, the question is, what have we understood? We have understood that wave after wave seems to be a phenomenon where the wave happens 3 months after the peak of the subsequent wave. By all calculation, the wave was expected to be here, and nobody, including any medical healthcare worker, wants the wave. The issue is, the wave which was supposed to happen in August may happen likely in September. If it does not, it is very good, but definitely the disease is here to stay in endemic pockets. Apart from that, what we need to realize is the delay for the wave actually speaks volume in favor of vaccination. As more people are getting vaccinated, we are seeing a delay in the wave. So also, this is a clarion call for everyone to have COVID appropriate behavior, such that we can ensure that we abort the expected third wave. With the easing of the lockdown, I think the responsibility of people increases far that to the responsibility of the government or regulatory authorities. As a duty-bound citizen of India, everyone, each one of us can contribute to the surveillance. Do not neglect symptoms. There is the option of self-testing, which you can encourage and use it, because the test, trace, treat is the mantra, and that will assuredly give very beneficial efforts in curtailing and aborting the incoming third wave. Self-test kits have their place, but it is too premature to call them as game changers. So, what are we seeing today? We are seeing number of patients who are on employment, universities, foreign universities, and as a requirement by the university abroad, people are self-testing themselves once in 4 weeks, 2 weeks, whatever be the recommendation in that part of the world. I think with the amount of IT/BT industries, it is important that the employer funds these test kits, self-test kits, and these kits are used periodically by the employees themselves. This will take the demand for testing from hospitals and laboratories, and they can cater to the patients who actually need this testing, whereas self-test could be intended for a surveillance program. So the self-test kits do rely on getting a little bit of a genetic material, presumably of the virus, and you do a swab, and that material is fed into the self-test kit, and within minutes this should give us the result. Self-test kits are very simple to use. You have a pre-filled buffer solution that is available. You have the swabs that are readily available within the kit, and you have the testing platform, and there is a QR code, and you can connect to the ICMR site to register the test, and this can all be done within a couple of minutes. Once you have cleaned your hands and you take a good nasal self swab, the swab needs to be gently inserted almost half a way through, and twirl it in the nose so that it will extract a lot of cells and material, and take it out and put it into the buffer. Couple of drops from this sample is fed on to the well of the testing platform, and that will give the color indicator whether the test is positive, negative, and that result is duly uploaded onto the ICMR platform. So one may worry about the expense of self-test kits. Would it be quite expensive? For the cost of one self-test kit, bundle of swabs and buffers, the QR code, everything included, you would end up spending double that amount for a single time testing in a lab, in a hospital setup. So the self-test kits are going to be very inexpensive, but it should be rightfully suggested to who should use it. Then it makes sense. If I am a student and I have to get a test every 3 weeks, then self-test kit is going to be extremely economical to me, as opposed to paying 2,400 or 400 to 2,400 in any lab. If given to the individuals who actually need it and a surveillance is required, it will turn out to be something that will save money. Self-testing kits have been introduced very recently, and in regards to that, I have seen a few people coming after having used the self-test kits. In most, I think the ease of use, the entire extended family can test themselves. Even from people from Bangalore rural areas have tested very reliable technique, and the results also kind of go with the symptoms that patients had. Therefore, it is user friendly. There is no urban rural divide in this. Anybody can use, and all the patients I have seen have had positive symptoms if the test was positive, and no symptoms. People who have tested negative have been very happy. This is one test, if it comes out to be negative, anyone is going to be happy about the negative status for SARS-CoV-2 testing.